If you're experiencing pain under the right rib cage, there are a lot of potential causes. One of the most common ways we determine the cause of pain is by creating a differential diagnosis or a list of possible conditions. So let's start by going through a differential diagnosis. Let's do it by organ system and come up with some causes of pain under the right rib cage. So the first that would come to mind might be the respiratory system, the lungs. So there's one on the right side and it extends down to the rib cage on that right side. So something that might be quite serious under the right rib cage would be something like a pulmonary embolism or a blood clot in the arteries of the lungs. This is a potentially lethal condition, and so it's my job to find it right away if you complain of pain in this area. Another cause of pain that might be from the respiratory system or the lungs might be something like pneumonia. So pneumonia might cause you to cough, to have fever, also to have shortness of breath. Or a lesser concerning condition that's respiratory in nature is called pleurisy. This is inflammation of the lining of the lungs, and people often experience this after a viral infection. Most of the time it's not dangerous, but it can be very uncomfortable. Now, something severe that might happen in your musculoskeletal system is trauma. For instance, if you fall, if you're hit by an object, right, you might have a broken rib, and that can certainly cause pain under the right rib cage. More commonly, though, are muscle strains. So if you've been dancing or exercising, you might strain muscles in between your ribs or on your chest wall that can cause pain under the right rib cage. So two conditions come to mind that are very, very common, and that's kidney stones and urinary tract infections. So kidney stones cause some of the worst pain that people can experience. People often say that it rivals childbirth, although I would never say that to a woman in labor. The other side of that is a urinary tract infection. And urinary tract infections, although we tend to think of them as being lower urinary problems, when they get to be as bad as they can be, the infection can spread up to the kidneys, and that can certainly cause pain under the right rib cage. Now, the gastrointestinal system contains a lot of organs and has a lot of functionality. Some of the important ones that I see very often are pain associated from the gallbladder. So the gallbladder is a little organ that sits just under your liver. Your liver is on the right side of your body, so the gallbladder is as well. And this organ helps us process food, particularly fatty food. Sometimes you can have pain after eating right under that right rib cage, and that might be a sign of biliary colic. This is a condition that's associated with forming stones in your gallbladder. Now, this can lead to cholecystitis, which is an infection or significant inflammation of the gallbladder that very often needs to be treated surgically. Other causes might be inflammation of the liver, a condition called hepatitis. Another condition could be dyspepsia. Now, this is a more benign condition, but it's vastly more common and very irritating to a lot of people. And this is a condition that is more commonly referred to as heartburn or indigestion. So it's a condition that has numerous causes, but is typically defined as a bloating feeling, a burning feeling, a fullness feeling, or getting sharp pain just after eating or while you're eating. So although most people tend to think of the heart as being on the left side of the body, it really is situated in the center. Because the inside of the body doesn't have specific nerve endings for specific locations, you can still be having heart pain and experience that as pain under the right rib cage. So I would also want to make sure you are not having acute coronary syndrome, or a heart attack, as it's more commonly called. We always say that diseases don't read textbooks, so you won't always get classic symptoms that you read about. So pain on the right rib cage or in the right chest could potentially mean that you're having a heart attack. especially if it's associated with some of the other symptoms. And this is particularly true of women, and this is particularly true of the elderly, and of patients with diabetes. All three of those groups tend to present with heart attacks that vary in their presentations from the standard or the classic version that we hear about often. Another cause of cardiovascular pain that you might experience on the right side under your rib cage is inflammation of the lining of the heart, a condition known as pericarditis. This is an inflammation that's sometimes caused by autoimmune conditions, sometimes it's caused by viral infections, and sometimes we don't know what the cause is. Could be medication, or could just be something that we'll never find out. If you're at home and you experience pain under the right rib cage, the very first thing that I would want you to do is to try and identify exactly when it started, because many times you can come up with the cause of it yourself. If you've just been exercising or were just struck by something, you might think that this is a musculoskeletal pain, and taking a pain tablet like ibuprofen or Tylenol or applying ice to the area might be the first place to start. If that takes care of the pain all by itself, then no need to come and see me in the emergency department. However, if the pain persists or if the pain is particularly severe, you should certainly seek medical attention, either by calling 911, coming to the emergency department yourself, or simply speaking to your own primary medical doctor.